Okay, I'm going to read some introductory remarks. This is the Sclerology Pocket video series is designed as a brief and casual platform, an informal way to connect with us eyologists. You know, the eyeball family, as Celso puts it. I like it. The format involves, what we do is we choose some eyology photos of a client or patient, and we consider, you know, what we're seeing in the eyes in terms of the eyology sciences over against what we know about them, which in some cases we don't know anything about them in some areas. So along with both basic and advanced concepts, we might throw into the discussion some recent research items. So be prepared for that. While the focus is sclerology, we also will be randomly employing physical iridology, as you'll see, as you've already seen in the first production here, personality iridology, and of course, Professor Andre's psychoenergetic eyology. So in other words, we're going to be using all of the eyology sciences. So for those of you who are new and just jumping on, please keep in mind that these videos are designed for those with at least some familiarity with the eyology sciences. While we will do our best to briefly explain some of the terms and the acronyms that we're using, some of them we might just breeze through. So to be up to date, to be up to speed with all the terms and the concepts, you might at some point wish to just take a course. Bear with us as we try to manage the sound and the video glitches that are inevitable when we're using these new communications technologies. And finally, unless you have a burning question that you feel, if you do have a really burning question you feel it needs to be addressed right away, the way you raise your hand is, how do you do that?
Chat, they could
go to the chat box and just make a sign. Otherwise, hold your questions to the end of the session, which, that's the idea.
Just second, Leonard, please.
Okay.
If anyone has a question, can type in the chat, or even ask, no problem. And if you type in the chat, Celso will help us. Okay. He's attend to the chat and reply the question and give us the question, right? So, but it also.
So otherwise,
go on.
Otherwise, you can just wait to the end. Wait to the end of the session, which is probably going to be about an hour, like it was last time.
Yes.
These were designed originally. Oh, we're just going to do these pocket videos, which means they're going to be 20, 30 minutes long, you know, and that's it, casual. But it wound up, because we're having so much fun, there's so many things that we felt like we needed to explain, it wound up being an hour. So this will probably be an hour also. Okay, we're ready to go?
Yes.
So I wanted to...
you want me to share the screen now?
No, you don't. Well, you could. Yeah, with the eyeballs, Gary's eyeballs. So while she's pulling that up, I want to run through just to bring people up to date, new people, and just to go over what we talked about last time. This patient, same one we saw last time, is an 80-year-old man, 80. He's 6 feet tall, which is 182 centimeters. He weighs 160 pounds, which is 73 kilograms. Okay, he complains of chronic lower back and neck pain, which he feels is because of arthritis. He's been diagnosed with arthritis. So he was hurt. He hurt his back from time to time, including when he was in the Army. His diet, during a 20-year stay on the South Seas Islands, he was on a high raw or all raw diet all those 20 years, which is really good. So he confesses now a preference for sweets, and you'll see how that connects with the eye. In fact, you can see at the bottom of your screen right there. Lately, he's been using restaurant foods fairly frequently. He's no longer living in that condition where he was in all raw foods. So the surgeries, he's had cataract surgeries, which you'll see when you look at his pupils. You can see how black they are, okay? He has had bladder malignancies just a few months ago. He actually, on the 4th of May, the little cancerous tumors in his bladder were surgically removed. While he was in the South Seas Islands, he may have suffered exposure to some pesticides which were used in his environment. Okay, his body apparently reacts or otherwise doesn't handle antibiotics very well, but he takes them all the time because he apparently tends to prefer Rockefeller Big Pharma medicine over natural medicine, you know, which he does whatever his doctor says, in other words, whatever his medical doctors say. So in 2016, remarks to me, he claimed he felt like he had hay fever allergy symptoms, including runny nose and itchy eyes. He says that he has been, and he still is, on thyroid medication. Okay, so you're going to look for signs in the eyes on that one. He says that he had a broken left wrist and right elbow from a fall from a ladder. He says that he had a flu shot. He didn't respond very well to that. And he had a pneumonia shot, which really irritated his body. Okay. He confesses a coffee addiction, which he adds milk or half and half to his coffee. He mentions personal mate type relationships, difficulties. Now this is, I like this. He claims to need 10 hours of sleep a night, but when he gets up after 10 hours of sleep, he still feels like he needs more. So, and you'll see that marker in his eyes. So he says he gets up to go to the bathroom to urinate 2 to 3 times a night. Okay. So he has been medically diagnosed with BPH, benign prostatic hypertrophy, prostate. Okay, and finally, acquaintances say that he tends to lack sensitivity to a person's feelings when he's giving criticism to the other person, criticizing their behavior. He doesn't know how to say it in a way that's diplomatic, so he tends to be dogmatic, and so he probably wouldn't make a very good diplomat. So we were getting into that. Professor André was getting into that quite a bit during our first session. Okay, so with that, where should we go? I think, see, this is...
We did last time.
Let's pull up his irises just very briefly. Okay, yeah, that's, okay.
That's the right eye.
Right, this is the right iris. So you can see, and we talked about how you see the inverted lower wreath. See how the wreath inverts toward the pupil? Okay, that's a Russian iridology sign for a tendency to sugar, or actually a sugar metabolism dysfunction sign. That's what it is. Or pancreatic dysfunction. Okay, what medically it would be called at least pre-diabetic circumstance. Okay, and here it is in the left eye, same thing, right? In fact, you even see a wreath break there. If it looks like you could magnify, and we could see if that really is a wreath break. Yeah, it is. So that's some real energy. And this is, remember he said he preferred sweets. He really likes sweets. You know how to get back to the, okay. Okay, so there's any number of things. You can see all the jewels using personality iridology. You see these jewels that are there. And several of them, you see their color. And Nenita was remarking on this is a liver colored one, and the others tend to be pancreas colored or endocrine colored. Okay, and you can see some iron spots. So there's some liver difficulties going on there. You can see the point of the wreath, the iris, the stomach ring, so-called stomach ring. So whatever he eats, he's got to chew it really well, or it's not going to get broken down very well. So he had better not be in a hurry. You could see the number of lacunas, where they are, and so on. There's just so much. And you can see the
trying to get this thing.
there's a what? What do you want to do, Nenita? Oh, you want to reduce the size?
Yeah.
You got to go down here.
It's not.
It's not working?
It's not working.
I don't know what that's all about.
Okay, now it's.
Now it's working.
Okay.
So he has a corneal arcus. It's well defined. You can see, we talked about the lower wreath, genetic tendencies to weakness in the arterial heart. There's a whole bunch of things, but we're going to be seeing those, and we'll be going over them, okay, as we go along. Okay, so we could move into the scleras. Usually it's best to start at the very beginning.
We did that last time. So we were just going to go through. This is the left medial quadrants.
And so you see what's going on. There's an interesting marker there that we didn't talk about at all last time, in that it's like a parathyroid, parathyroid up here. You see a perpendicular there. First of all, you see the, yes, and Nenita is encircling the perpendicular, which is a little tumor sign. She's got a little cyst or tumor. I'm not sure whether that's the thyroid or parathyroid. Both of them can have these little cysts or tumors. So you recall that he confessed to taking a thyroid medication.
And this is the right medial quadrants, again, thyroid, parathyroid.
And you can see that fork-like configuration. Some people, in certain circumstances, that fork-like configuration can spell Hashimoto's thyroiditis, to use a medical term. We don't use these medical terms. What we do is we use the completely generic terms, because this is the language of the scleras and the irises. They're generic. But you also see, you might want to magnify that right there. You see a squiggle that is in the thyroid, and there it is. And Nenita is magnifying it. See, it's a complete, like a little pigtail. There it is. She's just outlining it. And so we know that the thyroid itself specifically has a problem with its blood supply, blood pressure. So that's one of the 5 blood pressure signs that you can see. But this one is specific to the thyroid. So go ahead, Nenita.
And also, speaking of the thyroid issue, so both sides of the eye showing thyroid signs. So we know Dr. Jensen mentioned about thyroid as having profound effect also on the emotion. A lot of people who have depression or suffer from hypothyroidism. And so I'm sure that on the psychophysical level, Professor André has something to do with it. So we'll turn it over to you, André, at this point.
Okay, thank you. So about the correlation of thyroid and these lines, particular lines, very frequent, started with a primary. It was a primary A and obviously a primary B. So that means that this man has on his nature, the basic level of his personality, the vulnerability to correlate it with things about fear. I was talking about this last time a little bit, remember? So everything for him, which correlated with things that it's really true or not, things that it's fair or unfair things, that's really touch him and makes him I saw someone wrote that cannot hear. It's not. Can you hear me? Yeah.
We can hear you.
The sound is a little bit muddled, but it's there.
Okay. Maybe Leonard, just turn it off your microphone, cause
Okay, hang on.
the echo. Okay. Yeah. Thank you. Yes. Yes. Let's see. I think now we got the problem with the echo. Okay. So that means that this guy probably has a vulnerability with fair subjects. Okay, I mean, last time I said the word justice, and I've been corrected. That's it's about fair and unfair things. What else? Not only that, but everything that the feelings has the origin of measurable things. You know, when you lost something, the feeling to have lost something, it has the possibility to be measurable. You can measure what you lost, right? I lost a car, I lost some money, I lost something. So this feeling, you can measure what you lost, right? So the origin of this kind of feeling, it's possible to be measured, right? This has a special kind of energy, right? Let me put it on my image. For someone's it's better. Okay, so what's that means? What it maybe means on this guy? Everything that he gets on his life, from his work, his efforts, everything that he worked hard to get it, and it's a very maybe it's very important for him, right? So everything that he got during his life, it's something very important. Not only material things, but also the connection with right things, to straight being correct on his life, right? So this also the same kind of energy. Okay, so this is made part of his essence. This make part of his nature. It's inherent, right? And it's on the base of his personality. What that means? It means that when he's get a situation during his life with this kind of subjects, that's it's really hard for him, right? It's different from other guys that doesn't have this kind of energetic constitution. Okay, so for him to have the the um, the, um, the stimulus of this kind of energy with this kind of subject of emotion and feelings, for him, he received this, he perceived these feelings very strong, and that makes him suffer, probably makes him suffer a lot. And it's correlated with thyroid also. Okay, so thyroid is not only about things that you can express or you cannot express. It's not only about communication. There's lots of information behind it. Okay, on energetic level speaking. Okay, and this sign shows exactly that. This kind of line, it's a primary. Okay, it was A, get a B, and with strugglings and all that. Okay, tell us the whole history of him. Yes, this one, it's confirmed and very strong. When we see the characteristic of the line specifically, and now I'm not talking about the topographic area, okay? Before I was correlating with the map, as I showed you last time, okay? But now, talking just a couple of seconds, please, Leonard, about the configuration of the line, okay? This line, we know also it's inherent, it's also telling us about his basic level of personality, but shows also the intensity of energy that he nurtured cells, am I correct? He feed Yeah, he feed this energy on the time when the pictures was taken. Okay, so
Yeah, he nurtures this kind of energy.
yes, that's right. Thank you. So when this picture was taken, he is nurturing, he's feeding this kind of feeling. Okay, the quality and the characteristics of the line, this vessel shows us this. Okay, well, I think it's for a while it's okay, Leonard. I get otherwise I keep talking. Thank you. Give you back the words. Open your microphone, please.
There we go. Good. Yeah, you can hear Professor Andre's enthusiasm for his work.
So we mentioned this last time, but let's go to the right lower quadrant. Okay, let's see.
Yeah, it's over here. So you could, what I did was I diagrammed it. You could look at it before it's diagrammed, Nenita, if you want to. Just there or there. There's nothing there at all. So you can see that right away, boom. Those of us who have taken the advance, you can see very clearly an N5 NVA, the neoplasm marker. N refers to neoplasm or new growth, which refers to at least a precancerous, if not a cancerous condition. NVA, neoplasm vulnerable area. So
and for those people who are new to sclerology, one of the characteristic that we notice with the line is the lines usually are stronger at the base, and as it approaches to the iris, it's become
thinner.
But when the line started to get thicker, as is this one, and as it approaches to the iris, that's an important sign that we have to kind of take in seriously.
Yeah.
Because that's an area where the patient, if they don't have an obvious symptoms yet, they are going to
They're gonna have them.
they're gonna have that. They're gonna have certain signs and symptoms in the future, if not at this time.
And of course, all that we're talking about here, irises and sclera, these involve maps, and there's a map to all of them. I guess we should probably pull that up at some point. We could do it another time, but there are maps that are available of the sclera and of the iris. So,
and as we mentioned also, we saw the in the iris, we saw the orange pigmentation, which correlates to pancreas signs. And here in the sclera, this is the biggest, thickest line that we have seen so far in his eyes. And this is right
smack in the
pancreas area. So in the iris, it talks about more of a genetic predisposition. In the sclera, it's a system status indicator.
So it shows what's going on right now. So you can go to this one, Nenita, just to point now. You see the N5, neoplasm number 5, NVA, neoplasm vulnerable area. So the area is pointing to this area. Remember, it's thicker as it approaches the iris, which is not supposed to do unless there's a real problem there. And there is a real problem there. There's no getting around it. We could even go to this one. We're going to look at some of them. We just diagrammed this so that you could see these areas more clearly. Now, so there's a big question that just comes up. Remember, he complained of lower back pain and neck pain? Okay, if you follow this line up that starts in the cecum, you see it starts in the cecum, goes up, it goes through the prostate and urinary bladder, and it ends up right in the lower back, right in the lumbar area, the lower lumbar, even below the lumbar. So, and you also see there's an N6, that's another neoplasm marker. It's a little hook. How do we know it's a hook? You might magnify that, Nenita, just to verify. So these are some of the ways that you can see these things. Yes, indeed, it is a hook. So that's why, and it's getting thicker. It's getting a little bit thicker as it approaches the iris, and it's a hook, so it's an N6 marker. So you could back off and we'll take a look at some of these other ones. You can see an N7 there. But I want to point to a few other things here for people who have. You go down here to tool options and then just hit. Oops. Yeah. Yeah. Well, no, not that one. It's supposed to. It's not doing what it's supposed to do. Oh, there. There you go. Okay. Now go to full screen. Now you're all set. So you see a number of things there's a whole story here. You can see where the origin of the problem comes from in the lower back. It's causing problems in the prostate, the bladder, the urinary bladder, and the lower back. You can also see a connection with, we haven't gone there yet, it turns out that it's coming from the thyroid. That the thyroid is influencing these other endocrine organs, including the prostate and even the adrenals. The medical people say his adrenals look okay from the what is it, CT scan, right? They saw that the adrenals look okay. His bones, they say, look normal. Well, we already know from the corneal arcus that there is something going on with the bones. And from the parathyroid marker, we know there's a problem there, okay? So there's this whole story is being told to us in the scleras. When you add the iris information and the sclera information, we know so much about this. It would be the envy of any medical person. So anyway, on and on. Now you see the biggest marker here. This is probably the biggest marker in the whole eye. Okay, it starts in the cecum, goes up through the kidney, the right kidney. Okay, you see an N8 marker, a neoplasm marker there, and then you follow it up, and it turns into an N5-NVA. Remember, he complained he just really loves his sweets. I have a picture of him in a different country when he went to give a lecture, and he had a big ice cream sundae and a big smile on his face. So he's really into the sweets. No praise, no blame. This is just where he's at. But the medical people aren't discovering this. They never did a test for this. They never looked in this area. Okay, so we're seeing it bright, sharp, and clear. Okay, we can go to the.
No, Andre.
Andre has a. Yeah, Andre, please go ahead.
Thank you, Nenita. Thank you, Leonard. Can you tell me about his...
Andre, you're muted.
Okay, thank you. Can you tell me about him, if he's got any experience during his life that he maybe was on a high position of command or being the important guy or something like that, even at home, okay? I mean, and then he lost this kind of position, something like that, okay?
What was the question?
Oh, the question is, was he in an important position and later he lost that position of importance?
Yes, definitely. Yeah. He was in this special position with regards to
is it the church?
At the church, and okay. He served there for so many years, and then later on he got kicked out, and it's really hard for him to accept that initially.
Yeah.
He's sort of adjusting to it, but
yeah, he's now adjusting to it.
But to what degree, I don't know. Is
okay. That's why I love to say that that the sclera, it's not just a map of ourselves, it's a GPS. Give us all the way of our history, right? This line on prostate, it's the region for I do this question, for this ask, right? Okay, this line, the characteristic of this line and the position where it is on the prostate, okay? Yes, thank you, Leonard, exactly this one. Tell us about a possibility of this person being experienced situation that he lost some kind of position that he was important. He used to feel himself important. Then he lost that, right? Excuse me, Celso, prestígio. Ele se sentia prestigiado e perdeu isso.
Yeah, he felt that he had prestige.
Yes.
He
Then
was
he
a
lost it. He just
person.
lost it. He felt like the carpet was pulled up. He
Full. Yeah.
lost the ground. Okay?
Yes. He
Right.
actually feels like he was not expecting it. He feels like there's an expression, the carpet
Pulled
or
out
the
from under
rug.
him. Rug pulls
Yes.
out.
Under
It's the
him. Yeah.
same in Portuguese. Okay.
He was like a almost like a not a first hand, but he's always there next to that person, important
A
person.
really
Exactly.
important person.
That
Yes.
Right.
feeling, that kind. Yes. Thank you. The raw generation detox said exactly that. The prostate, and this line on the prostate, which becomes on the top the N6, okay, it may become correlated with this kind of feeling, okay? This kind of feeling has the energy to contribute for this situation on the body, right? So, and that is connected with the other line, which are coming from thyroid, what we were talking about before with the other quadrant. Remember, that line, it's coming from there. Yes, thank you. Exactly. Yeah. You see, it's a GPS. We have all connected. All emotional, all personality, all vibration, all our energy is connected. And it gives us all the way, right? So it's just to put the information together. Then that one shows us that maybe happened something on his life, and that can be the key for the other one on the pancreas, right? And what's the feeling? What that the other on the lower quadrant showing us is the feeling of the question of why me? Why with me? Why that happened with me? Once I did everything right all my life, I dedicate all my time for that, and then happened that with me. So he's feeling a deep regret. I think that's right, yeah? A deep regret, a deep suffering about that, which is nurturing,
Right.
yeah? Ressentimento muito grande, tá? Which may become a depression, right? And it's feeding that big line, the N5 on the pancreas. So this is the kind of treatment, of emotional treatment that we have to help this guy on psychological energetic level, right? To help him together with nutrition and all good life to help him to come up. Okay. Thank you.
André, and
Yes.
Leonard, please. I think there's a question that is pertaining to exactly this area, and I think it should be addressed right now.
Okay.
From Carolyn,
Please. Can you read it?
would we see the same representation and line configuration for women in the uterus area with the same emotional circumstances?
Not really.
Did you
No.
read this out?
No, it's different.
Okay.
Caroline, you can see the comparison if you have a case of with this kind of situation, of this kind of sign. Please investigate about go for to see about rigid carrot, right? Someone who pushed himself too much, and of course with women subjects. Okay, it's just to give a very short answer about this, but it's different between men and women. Okay.
Women who have a rigidness of character.
Women with rigid character, yes. Okay. Thank you. Leonard, please, your word. Welcome, Caroline. Leonard? Don't forget to turn it on your microphone.
Now we're good. Now we're good. Okay, if you go here first. I just wanted to take a quick look at this. This is the R2 view. It's a research angle instead of the primary or cardinal views, the 4 views. There are 4 other ones which are research views, and this is one of the research views. And this, the reason why it's so important is that it allows us to see the connection between 2 quadrants. So we can see now the connection between the right medial quadrant, which is, Nenita, if you could point to where it is, it's up here, and the right lower quadrant, which is down here, which we were just looking at. So you can see that connection very clearly. And this is a very important connection because we're seeing, as you remember, the line that emanates from the thyroid negatively influencing, going down and connecting with the prostate and the adrenal, which are other endocrine organs. And since the thyroid is superior to those other organs, it's going to send negative energy to those other organs, and they will not be able to function up to the level that they were designed to. So you have this negative influence, and you can see. So this is another way that the sclera is, thank you very much for this, Professor André. It is a GPS. That's great. I love that term. The sclera is like a GPS. So you know where you're going and where the markers are coming from. Okay, so I want to just see that, and then we did a little trick in Photoshop. Oops, where are you? We did a little trick in Photoshop, which we're going to do a whole class on Photoshop usage at some point soon. And we made it so that you could see some of these lines in relief a lot clearer. Okay, so that's possible to do. And but this technique is especially good to see certain NVAs, neoplasm vulnerable areas, especially NVAs 1 and 2. But here, these are higher NVAs. They're not the higher the number, it doesn't mean it's worse, not at all. That's just the order in which we discovered them. Okay, so you can see these, the ones in the lower back, the ones involving the prostate or the pancreas, and also the prostate, as you can see there, that we talked about earlier. So all of these, so these are potential. So you're thinking, okay, we could probably go to another, but before we get into that one, I just wanted to mention, you think, well, holy smoke, this guy's got 1 foot on a banana peel and the other already in the grave. But well, you can have a lot of these. This is definitely more than the average person has. But then why does he sleep so much, right? How come why does he need so much time sleeping? Well, here are some of the reasons. You can see right here, this marker is coming from the vital force area.
This is left upper quadrants.
Mm-hmm.
And then I'm just gonna pull out, where is that is the right upper quadrant.
The right upper quadrant. Now this one, of course, this is not in the vital force. It involves the vital force a little bit, but mainly it's coming from, and I think I diagrammed this. You can go to the next one, Nenita, and you'll see it. Is that in the way? Yeah. So it's from the hypothalamus, which is the boss of the entire endocrine system. And so you see the marker comes down. What kind of a marker is it? It's a D3. It's a drug marker, drug/chemical marker. Okay, and so it comes down
Because
here.
the configuration is a straight
Straight.
line with a meander.
So when you have that combination straight with the meander, you know you have drug involvement, drug or chemical involvement. Okay, so the pituitary is definitely out. It's not performing up to, you can tell that from a number of ways. Number one, the thickness of that line that goes right through it is a congestion marker. All these lines are congestion markers. All right, and then with the straight line beside it, you know that there is some kind of drug or chemical involvement. And because of the forks, two forks, you see, and the fact that they cross, you have a D3 with the forks, and the crossing means a D4. So the higher the number in this case, the worse the circumstance, the more functional loss of that organ. So the pituitary is what is hurting, okay? And then it goes down past the pituitary and to involve other brain centers, right? We're not going to get into those. So
this is coming from the vital force.
It's right smack in the vital force area. And then you can see how this is draining his energy. That's why he wakes up after 10 hours, my goodness.
And not
sleep.
To mention the adrenal line that we see on the right lower quadrants.
Mm-hmm. So this one goes through, if you want to point to that, that goes right through his pituitary also. It's not as exaggerated, but it is definitely there. Okay, and then this other line goes down to involve, we could look at the L4.
That's going to the heart area.
And it goes into the heart area, thank you.
And so if you remember all the lines that we mentioned, we saw most of the big lines on this person's sclera is tending to be, for whatever reason, is on the right side. And we mentioned last week, because he has also the tendency in terms of his personality to be always has the last word, or always tending to be the right.
It should be done my way. This is the way it is, and listen to me because I know that sort of thing.
Yeah.
Right. So you can see that. Can you see why last time during the first session that I mentioned that we could be on this for weeks, just on this one person. Something.
Okay, Andre, it's your turn.
Thank you. Just two words about it. There is one thing that really drain our energy, our vital force, our vitality inside of psychoenergetic things, okay, inside of feelings, right? Not saying about good health practitioners, not about food and exercise and all that, yes, but about the feelings. What kind of feeling that really drain our energy is the challenge to work with forgiveness, okay? Once you have the difficult to forgive something or someone in your life, you have no idea how much of energy you spend of your physical body to sustain this connection with something that happened with you, right? And if you see that it's coming from the vital force area, right, which is connected with the area which are correlated with our honor, right? Now I'm talking with my map, with show us that something injure our honor, you know what I mean? And I'm not okay with that. I'm very, very injured with that. Okay, so and my difficult to forgive that or someone or the situation or whatever. And if you see the line, it goes down there as we saw before, yeah, goes to heart area, which are connected completely with self-esteem, and we talked about that last week, yeah. Yes, thank you, Nenita. With his self-esteem, and also makes him ask, who am I? Do I deserve that? Do I not? Why it's happening with me? And I have some kind of beliefs which is very strong with me, and it's happening something in my life which goes through to my beliefs. It's shocking with my beliefs. Yeah, it's testing myself. Yeah, so this helps a lot to make this guy very tired. He can spend 10 hours sleeping and going to wake up, oh my God, you know. Of course, I'm saying into the correlation of psychoenergetic. Yeah, we get together with nutrition and good health on physical body. Yeah, it's the big seven, isn't it, Leonard? Okay, back to you. Thank you.
So, add to what you are saying with regards to vital force, not enough energy. We saw line in the adrenal, we saw the line in the connecting the adrenal to the thyroid, and we see the lines on the vital force. So let me just pull out that image. Where is it? Upper quadrants, right there.
Mm-hmm.
So, if a person, in terms of psychoenergetic, I mentioned last week that the psycho energy or the emotion, the mental emotional aspect of the person has a profound effect on the physical level. The physical level is the last kind of signs that shows us what's really happening.
The last energetic level, the lowest energetic level.
And so what we are seeing here in the sclera is the result of all those energetic
levels of energy
that's happening with the being. And in terms of the physical, if you look at it at the physical, if there's enough force, energetic force of hurt, anxiety, stress that's putting the person on, the cortisol level will be higher. And what does it do on the physical level when the cortisol level is high on the system? That would increase your tiredness, that will increase your adipose tissue, that will drain your energy. There's so many negative effects that would affect your sleep, that will affect your entire energy level.
Mm-hmm. You could go to the right lateral just briefly because we have to leave some time for questions.
Right lateral?
Yeah, right lateral. I just wanted to show them something that also right lateral. Look,
right
this one
here.
right here. Yeah, there you go. And there's another one that's the next one that I actually diagram. You might want to pull that up. Yeah. So there's actually a connection here. You see the lungs area, and you see there's a connective tissue dysfunction sign there. But see, this is coming from the venous coronary, the venous cardiac area, so the veins. All right, you see it going right through the central immune, the congestion in the central immune. It's the immune central of the body. It moves into the pulmonary area. See, there's a connection with the lungs. So this makes him vulnerable in that area. But the immune, that's what I wanted to point to especially. And this in the pulmonary, it's another NVA. It's an N5, neoplasm vulnerable area. So this is yet another one when Nenita was pointing to the left lateral quadrant, which you could go back to that one, you could see that it was not marked, but there's a N2 there,
A large webbing.
a large webbing marker in the in this area.
Thoracic.
And you see the thickening lines here that are involving large blood vessels. See, so there's just all these things going on. Also, this pigment area in blue eyes, you don't want to see that in blue eyes, but there it is. So that's another liver marker. There's so many things happening. So we have to somehow, all you can do in a case like this is you can point the person and he, in the right direction to the big seven, as Professor André was talking about. But you can only hope. He already has so much faith in Rockefeller Big Pharma medicine, doing whatever the medical doctor says. In some cases it's very good if there's really good suggestions, but they're not going to be telling us about natural health practices. So that's the best you can do. You can point them in a direction. As a healer, we're not there to heal people. We're there to give them directions. And be doing these things ourselves. So we're going to open up to some questions now.
Andre, you have to.
Professor Andre, did you have something you wanted to add?
Thank you. It's just two words about the big net here, big rumbling. The big net, isn't it? That's reinforce the aspects that all the things that happen with him, it's more correlated. It can be more correlated with social relationship than family. Okay, so particular this sign, right, makes us the direction to ask the ones what may happen if something happened on social life about these things, the same kind of things that we talked before. Yeah, just that. It's great. It's really good. Thank you. Leonard, I think we can, Dr. Leonard, Nenita, I think we can open to questions now. Yeah, we are about 50 minutes of talking. Yeah.
Okay.
Leonard?
Yes, sir.
Since both of you mentioned the big seven, could you quickly list the big seven? Yes.
Sure. It starts with the gross physical body. You can help me with this. This is diet. Diet is number one because the gross physical body is essentially a food body. Rest and sleep is another, a second one. Exercise is very important. Move it or lose it.
Did you mention rest and sleep?
Rest and sleep, yes.
Yeah, personal hygiene.
Personal hygiene is one of the big seven. Your environments, and that includes your personal, like emotional environments, the people you hang out with. You don't want to be around negative people all the time. And the environments, the home and work environments, are they clean and neat and decent? Are the kids running around like crazy and screaming and yelling and dogs barking? And what kind of a environment do you have? All right, and then there's the job, the work that you have, that you do. And then the last, of course, is your spiritual cultivation. The most peaceful people in general are those who meditate on the divine, who have a connection with the divine. What is the divine? It's the giant sea. It's the context in which all of this appears. It is I don't know how to say it better than that. God, you can give any name to it, but it's the context. It's the consciousness, capital C consciousness, in which all of this appears. What is your relationship to that? Okay? So, any questions? Thank you for asking that, Celso. That's very good.
Yeah, Carolyn shared the big seven. Thank you, Carolyn. Any other questions?
Well, we answered everybody's questions. That's wonderful. Nobody has any questions.
I think we are ready to give them the exam.
Oh, we forgot. I'm sorry, we forgot to tell you. There's a major exam, and if you fail, there, you will be severely published.
Would you like, Andre, would you like to share with us your research with regards to the psychoenergetic aspect, how you develop the map?
Okay. Yes, I can talk a little bit about that. My research it's about the psychological dynamic of the mind. Let me just ask Leonard, Dr. Leonard, please turn off your, yes, thank you. So I've been researching about psychological human being, the dynamic of the mind, especially on energetic level, for about 30 years. I used to be a teacher at the university on natural health program. We have in Brazil graduation college course, level of college on it's not naturopathy, but we call it naturology, because the focus it's on the health, not on the disease. Of course, we do study the disease as well, but all the focus is on the health. And I became teacher of iridology and all the subjects about psychological, the traditional Freud, Wilhelm Reich, and Jung, Carl Gustav Jung, all that. Also anthroposophy from Rudolf Steiner, and also the basis of naturology is the traditional old medicines like Ayurvedic and Chinese and what's the name in English for the last one? The Indians medicine, shamanic, yeah. When we say shamanic, sometimes it sounds weird, but it's about herbs, therapies, and all that, yeah. And the correlation of the human being with the nature, okay. So we get deep study in all that, plus study of psychological systems and dynamics and modern physics, what quantum physics properly, right? Which I went to study very deep for the last 15 years to explain better the correlation of the human being, the gross body, and yes, Barbie, I do teach psychological iridology, yeah, and psychoenergetic iridology, right? So I did a deep study for the last 15 years, or a little bit more than that, on quantum physics as well, to explain better, not only just to say quantum physics does explain what it's unexplainable. Is that English? I don't know. Anyway, so that we can't explain. So we usually say, oh, quantum physics does. Yeah, but how? Which law? How does it happen? Yeah, so to get better explanations about the human being as an energetic level. So making all together, then I met Dr. Leonard and Nenita, and I got in love with the whole thing, sclerology, and them as well as family. So then I studied all the connections for the last 10 years, making the correlations of the sclera, all the different levels of sclera, and all the signs and combinations of sclera signs. Also, I had already the iridology psychoenergetic ready, and then make all that on the sclera, and believes is not really same. There are many different things. Yeah. So, Nenita, I hope that I could answer a little bit about that. Yeah. So.
Yeah, just amazing how I've been involved personally with iridology and sclerology since I met Leonard almost 27 years ago. And so, and it's just amazing how some people think of us as an expert. We are also a student because we learn every day. And like what like what Aunt Professor Andre have found out that with all this research, there's certain things at this time we cannot explain how things works and how things shows up in the eyes. But later on, I know that certain technology, at this point, we may not be able to explain the things that we see in the sclera and how they show up and how they influence the physical body, but it doesn't mean it doesn't work. It's interesting how in allopathic medicine they use the technology for diagnostic, the energy, for example, the MRI, the CAT scan, those are in terms of energy, and yet they don't, at this time, they still don't include energetic healing or the psychophysical, psychoenergetic aspect of an individual in terms of the healing.
Mm-hmm. But there are good reasons for that, and they're political, but we can get into that another time. So next time what we're going to do is we're going to pull up another patient, another victim, another client.
Actually, Dr.
Yeah.
Leonard, we are arranging to have someone alive with us, a client alive with us, I mean a patient, a voluntary to be with us. Of course, we are going to take care to don't let his identity come up, yeah, with no camera, different names, or everything, only the eyes, and he don't. We're going to show his eyes after that. So we are planning that for next time, for next week, yeah. And then,
okay. So there's gonna be a live person who is gonna be.
Yes, I'm working on that. Yeah, I'm working on that. And then, if people are interested, and if you are interested, and people are agree, if you are agree, we can talk 5 minutes at the end or something like that, and I can explain a little bit the correlation of different parts of sclera. I mean, sclera, episclera, conjunctiva, all these parts are related with the personality and the energetic level. Okay, so so then it's we can bring that next week. Okay.
Okay, all set then? We're good?
Yeah, we are good.
There's a question from Carolyn.
Carolyn? Go ahead. You can unmute yourself, Carolyn, if you like. Can somebody unmute her? I don't know if
No, we can
do
do by ourselves. She needs to do it.
Yeah, she has to do it.
I was just curious to ask when we can expect the English translation of the psycho-emotional law, Professor.
A good question.
Yes, we are working on the translation of our old materials, handbooks, and which going to become a book, books on vibrational sclerology and psychoenergetic sclerology. So it's very vibrational fields levels correlated and emotional levels all correlated with sclera. And we hope as soon as possible we have this material ready. Then we're going to be ready not only to offer the material, the books, but also a course. And saying in advance, maybe, Leonard, we are planning to do a whole course of sclerology, including all the knowledge, all the levels, yeah, so vibrational, psychoenergetic, physiologic, all together, and then we do the whole sclerology, yeah, so.
I don't know if I can handle that kind of fun. I mean, that's above my normal fun level.
We are going to have fun.
Yeah, we always do. We always do.
Thank you for asking.
I think, is that everything? Is that anybody else? I had a question per Carolyn's question. Is it possible that the map, the psychoenergetic map, could be available before the text, before the books,
yes.
so that people could at least have that? Good.
That's the easiest part. Because just a few words to translate it, yeah, it's easier. But the point is, that's okay. That's no problem. But it's going to be very useful after to have the knowledge and understand the meaning of the lines, what kind of lines means what, and on each area. Well, it's just the same thing that you have Dr. Leonard's map, yeah, and don't understand the lines, yeah. But yes, we are going to have it pretty soon, and if you already have an idea, you're going to be able to begin, yeah, and do some analysis with that. Okay.
Good. I'll end with this. I can. So many people ask about the new map book, the second edition of the Sclerology map book. It is finished. I mean, but I've turned it over to Nenita. She has to finish her art on it, and then it will be available. And I can tell you that this is my masterpiece. It's the best thing I've ever done, ever produced in the Eyology sciences. So we'll let you know as soon as that's ready. Okay.
Yes. Thank you. Okay then. So
we're good.
Let's meet all together next week. Same time, same link. Don't need to send an email to us asking for the new link because it's the same one. Okay, you are already invited, right? And you can also send this link to friends, to other people. Are very welcome. Okay, so it's got easier because I have to say in my institute I still don't have someone to help me answer emails in English, right? So that's got a little bit hard for us, and sometimes people are waiting a couple of days until I can answer the emails. All right, so thank you, Dr. Leonard, Nenita. Thank you very much for once again get together, and all of you participating. Thank you very much to being with us, and we hope to see.
Thank you so much to you too, and to everybody.
Okay.
And see you next week. Bye bye.
Thank
Bye,
you.
everybody.
Bye. Bye.
Bye, everybody.